Today we are going to study MUR. It is a chloride of magnesium constitution especially adapted to diseases of women. The diseases in women, they are usually spasmodic and hysterical disorders complicated with uterine diseases. Women who have suffered a lot from indigestion and bilious attacks for many years. Generalities: great sensitive to noise is characteristic of MUR like Ignatia, Nuxomica and Theridion. Child: MUR is a very great remedy for children who are during the age of dentition. It is indicated for difficult dentition, dentitional diarrhea, children who are unable to digest milk. It causes pain in stomach and passes the indigested milky stools. Children who are punny or rickettsia look and who desire for sweets is characteristic of MUR child. Headache after every 6 weeks, especially frontal headache is characteristic of MUR. The forehead pains as well as there is pain around eyeballs as if eyeballs will burst out, and headache which is aggravated from motion and in open air. Also, headache is aggravated by lying down, which is very peculiar of MUR, and aggravation by pressure also, or headache is aggravated by wrapping up warmly. MUR has a great tendency of head sweats a lot like calcarea carp or sanicula. Teeth: there is toothache. When food touches to teeth, they just pains very sharply. Stomach and abdomen: there is a continual rising of white froth in the mouth. Eructations in MUR, they are like a rotten egg or onion like smell of eructations. Pressing pain in the liver region, which is aggravated by walking. The liver in MUR is enlarged and it is aggravated by lying on right side or lying on the same side. Stools are hard and knotty like sheep dung. It is very constipated. There is crumbling pain at anal sphincter and stool is very difficult to pass. Especially child of MUR cries holding his anus while passing stool, especially during dentitional time. Heart and circulation: palpitation with angina, cardiac pains while sitting is very characteristic, and that pain or angina is aggravated by motion or by walking. Genitourinary system: a pale yellow urine is characteristic of MUR, but MUR patient has to put lot of pressure to urinate. It's because of the weakness of bladder muscles. Bladder muscles, they are circular muscles and they are very, patient feels very feeble or weakness of bladder muscles, and he cannot pump the bladder muscles. That is why they have to put lot of pressure in the pelvis like sepia or lilium take. So please remember, weakness of bladder is characteristic of MUR. Now we'll come to female reproductive system. Menses, they appear with great mental excitement. This is a very characteristic remedy which is indicated in hysterical females. Period flow, it's dark and clotted. Metrorrhagia with dysmenorrhea, pain in lower abdomen, especially pain is felt in sacrum, low back pain, as well as that pain just refers to thighs. Inner aspect of thighs is characteristic of MUR. Metrorrhagia is aggravated at night. That means when she is at rest, blood flow is more, and hysterical complaints also appears at night. MUR is also indicated for leukorrhea. Leukorrhea, especially after exertion, or leukorrhea while passing stool, is characteristic. Also, leukorrhea characteristically begins. See, this is a very important drug for metrorrhagia, but as soon as flow stops, leukorrhea starts after 2 weeks till the next cycle appears, or leukorrhea especially starts after 4 days of the cycle. For this, please compare this drug with Baritacar, Conium, and Borax. Please keep watching Homeopathy in 2 minutes for students. Thank you.